Hello everybody. I just thought I'd put together this quick presentation just because it's very difficult when you're studying by distance, when you've not actually got someone in front of you to talk about the difference in dosage principles and why some and others don't apply. Obviously, I think one of the key things you should bear in mind when you're a distance student is try and use the forums as much as possible. I know it's difficult and we're all very time poor, but it just will help you clarify some of these issues. But anyway, I wanted to go over the dosage principles just so that you might get a little bit more familiar. Just very quickly to review, when you're looking at your cases, you really need to look at a triology of factors. One is the patient picture, conditions and symptoms that are presenting, and the herbal medicine to be used. Please remember, everyone's an individual. Personal prescription is for that person, not for the theory of the disease. And what does that mean exactly? It means essentially, when it comes to dosage principles, you might have a gentleman in front of you that weighs 110 kilos, and then you might have a girl in front of you weighing 49 kilos. Well, it's more than possible that the gentleman that weighs a little bit more than the female may actually respond much more quickly to far lesser dose of herbal medicine than the young girl that you might be treating. So you cannot generalize. You really need to, in most cases, you start low and build up, and you really need to look at constitution. So the patient picture, we really need to look at age, size, constitution, their lifestyle, how their work is, other stress levels. There are many, many factors. You really need to tune into that person, and that will come with time and practice. So please don't panic at this point in time. You've still got a while to go. So conditions and the symptoms, you're really looking at what's it all about? The who, what, where, frequency, the pain. Etiology is very important in here as well. If you have a certain condition, what triggers that condition, and how does that etiology relate back to the person you're treating? So, for example, if this person has constipation and it's obstructive, how has that happened? What is the etiology of obstructive constipation, and what is in this person's life at the moment that may well have impacted this? They might have been diagnosed with cancer or fibroids or something like that. And fistulas, these may well be present. It's important to have a look at how something happens. So herbal medicine is basically, as far as prescription goes, based on the law of contraries. So basically that means we take a condition such as constipation and we'll use a laxative. So laxatives will obviously do the opposite of what the condition is. Homeopathy uses like with like, and so does vaccination. We select herbal medicine according to their action, so the classes. So if we want a tannin-like effect, we might use astringents. So what is the herbal impact? We need to consider that. Do we want to normalise the system? So do we want to use herbs that have more of a tropho-restorative, adaptogenic or normalising amphoteric effect? Are we looking at tonifying, nurturing and nourishing? Or do we want an effector? Do we need herbs that have an observable effect, such as the anthraquinone herbs or the cardioactive herbs? Or are we looking at whole plant action? So the polysaccharides from the shiitake mushroom and from echinacea are very much responsible for that anti-inflammatory, antimicrobial effect. So the model for the Western herbal medicine prescriber, you really need to understand your pharmacognosy and try and start enjoying the complexity of it. Know your chemistry, know the actions. This takes time. Understand body system affinities. So if you're looking for a tropho-restorative or an amphoteric for the reproductive system, you might go to depending whether it's a male or female you're dealing with, although in theory there are no such thing as female and male herbs, and many people consider chaste tree or vitex to be a female herb, but it works very well with young boys with acne, so it's a great tropho restorative to the hormone system. It works on the hypothalamic pituitary axis, which of course we all have, both male and female. So don't forget to use your intuition. It has a great role to play in the healing, the rapport between the herbalist and the herbs. You'll have your favourites. So the clinical reason is really the underlying clinical practice, without which your practice becomes a technical operation, and you may as well just point someone into the direction of the nearest book. You need to make sound and defensible clinical decisions, so you need to understand why you're giving something. If you're going to give, if someone's got diarrhea, you're not going to give them a laxative herb, you're not going to give them senna. So you really need to think about what you're doing. Demonstrate autonomy, competence and accountability. It's a Sunday, I should be doing this. So what facts do you need to take into account? This becomes a lifelong learning, and your peer groups, your years of study, it will become constant and continual. You need to read, you need to bone up, and you'll learn through clinical experience. Your treatment rationale and prescription. You need to establish a protocol and time frame with using a holistic approach. As much as possible, use your kitchen medicine, use prevention, use teas, use kitchen food as kitchen medicine. Treatment goals and the actions required. Is it chronic? Is it acute? Look at the person. So when you look at your clinical case taking, you need a thorough case history. You need to observe, to question, to listen and record. Have some knowledge and understanding of the complaint. Use some in-clinic testing tools, and certainly be using your blood pressure monitors and temperatures. You may need to refer for pathology for more testing. Consider differential diagnosis. Make sure you know whether it's obstructive constipation or lifestyle. Consult. Don't be scared to talk to other people. And you do not need to come up with an on-the-spot treatment plan, particularly if it's complicated. You can very clearly say to your client, look, I'd like to have a think about this and make it up tomorrow. Hippocrates says the job of the physician is to cure sometimes, heal often, but always support. There can be a bias in thinking. You don't need to overthink it, but basically don't assume that you've seen this case tons and tons and tons of times before, so you know what the script is going to be. You need to make sure that you've listened to the parent. Your basic naturopathic principle, your first is to do no harm, and your last is to be a teacher to your clients. Paracelsus noted the difference between a remedy and a poison was often the dose. So when does comfrey become poisonous? When you feed 1,000 leaves to a rat. So dosage or posology principles. So the definition is an administration of a therapeutic agent in prescribed amounts. This is a fairly hot topic in many areas. I mean, you have many different practitioners. Traditional Chinese medicine use huge dosaging. We tend to use a pharmaceutical dosaging when we're delivering Western herbal medicine from the college perspective. And you have other schools that use drop dosaging, more akin to esoteric in many respects. So once again, you cannot generalize. You might have a tiny little girl who takes massive amounts, a bigger person that takes much less, still with the same effect. So really we need to look at herbal treatment. We look at the research. Many herbs are now being researched, so we're getting the gold standard double-blind studies where they need to be replicated, and they use clinical dosaging formulations. So don't get too caught up in it. So what's a 1 in 2, a 1 in 1, or a 2 in 1? Basically, It really depends on the manufacturer. So you have some manufacturers that believe when you're looking at a 1-in-1, you really need to have a larger volume of percolate. So you might have 1 litre of concentration and 2 litres of percolate. This actually can lead to a few issues around extraction processes. So some companies such as MediHerb use a cold percolation process, and essentially what is now developing is with the characteristic compound of a herb being measured for its quality standards. You might get herbs such as ginkgo that are now 2-in-1s, and they're standardized towards a manufacturer's recommendations. This has also impacted on herbs such as licorice, where the 1-in-1 would traditionally be used at a much higher dose, but with the 1-in-2 extraction process, that it now falls into the category of a medium dose herb. So once again, please don't get too caught up in the process. You will essentially be looking at the side of the bottle. Got a few bottles here. I know you can't see them in detail, but they will tell you, if you have a look at the Korean ginseng or the MediHerb bottle, that's a 1-in-2. The herbal extracts will be 1-in-1, and some may not even detail, although they should, whether they're a 1-in-1 or a 1-in-2 or 1 or 10. You simply fall by the instructions at the side of the bottle, which will give you a daily and a weekly dosage. So really, once again, it's not until you're out there and you've got your clinic and your dispensary there, you can only use any books as written kind of guidelines, but ultimately you'll be referring to the back of the bottle of whatever mix you're using. So, however, saying that, we can actually sort of generalize a little bit more here. So let's just talk about herbal liquid dosages and blending from a historical point. The eclectics would use certain dosaging, but remember the eclectics had very different manufacturing processes. They didn't have the laboratories we have nowadays. Then you have the dosages that are recommended by the pharmacopoeias or the expert committees such as ESCOP and the German E-Commission, or the BHP, which of course was written in the 70s by a number of different herbalists, so it was really their recommendations. Then you have the new dosages that are being established for pharmacological and clinical research, such as Devil's Claw, which in the BHP is dosaged at 10 mils per week, but in new clinical research it's 80 mils per week if we want to use it to reduce inflammation and pain in conditions such as arthritis. And then, of course, as I was saying earlier, you look at the recommended dosage from the manufacturer. Okay, so let's prepare a formula based on a weekly dosage. So the easiest way to arrive at a dosage is to use a weekly dosage. So basically the patient will take on average 5 ml of the formulation 3 times daily, which amounts to 15 mils a day. This equals 105 mils weekly. Now, although your bottles are 100 mils, that standard 100 ml medicinal bottles can actually take up to about 110. So you can essentially work on 105 mils. I would strongly advise you stick to 4 to 6 herbs in a formulation. You can even go as low as only 2 herbs. So, for example, Carver is a high-dose herb at 75 mils weekly. St. Mary Thistle, you might put in 25 mils, which is a medium-dose herb weekly. And essentially those two together would equate to 100 mils, and you could basically be giving 15 mils a day of that dose. I hope that makes sense. So anyway, let's look at a 5 herb mix, and your formulation should essentially look like this. So the one thing I haven't included on this, and I apologise, are the ratios. So when you put together your formulations, I do need you to add in the column with the 1-in-2, 1-in-5, 1-in-6, 1-in-10, basically showing me your understanding of whether they are a low, medium or high dose herb, which you can also get from the NCC dosage chart, which is only a guideline. and obviously as research changes, some of that changes too. So if we look at this particular one, we're looking at elderberry at between 15 and 40 mils weekly. I've put it in at 25s in 100 mils, so you can see the last two columns, one's 100 mil, one's 200 mils. So really you're looking at the second to last column. 25 mils elder, 25 mils echinacea, 20 mils of glycyrrhiza. Now we are assuming this one in this case is a 1 in 2. So all of these are 1 in 2s. Marubium, we're looking 15 to 40, 25 mils. It's a very bitter cooling herb. So this is actually a fantastic respiratory combination, which you may want to use next term. Excellent for both, really for upper respiratory infections. So then you would look at the 5 mils TDS 3 times a day. So let's quickly, and of course include your cautions. Let's look at children's dosaging, because this is probably the one aspect people get absolutely polarized on. Now, there's a number of methods. We have Young's rule, Salisbury rule, Freed's rule, Dilling's rule. So I'm going to go through Salisbury, which is one of my favorites, but this is really for children over 2. So you take, if their weight is less than 30 kilos, so for example, a 24 kilo child, you would times 24 kilos by 2, that equals 48. That is essentially saying that a 24 kilo child at 40 times 2, 48% of the adult dose. So if you've got an adult dose of 5 mils 3 times a day, you're going to do 48% of 5 mils, which is around about 2.45, 3 times a day. If their weight is over 30 kilos, you would do their weight plus 30. So for example, a 32 kilo child, you would plus 30 to that 32, that equals 62, which equals 62%. This is the percentage of the adult dose. Freed rules was really for under 2-year-old, and this is a simple one. It's the age in months divided by 150 multiplied by the adult dose. So essentially, if you had a 12-month child, you would divide 12 months by 150. This equals 0.08 times 5 mil, which is the adult dose, equals 0.4 mil 3 times a day. Young's rule is the age of the child plus 12. So basically, and this is then divided. So if, for example, you had a 6-year-old, you would say 6 years, and 6 plus 12 equals 18. So you would do 6 divided by 18. This equals 0.3 times 5 mils. That equals 1.6 mils TDS. Dilling's rule is age of child divided by 20 times the adult dose. So you basically would say 6 divided by 20 equals 0.3 times 5 mils equals 1.6 mils TDS. Try and do some working out, some calculations on that. It doesn't take too long, but once you get the idea, it becomes a lot clearer. Okay, just a few considerations. When you're looking at tannin-containing herbs, certainly such as oak bark, they're incompatible with alkaloids such as golden seals. They basically recoil from each other, so do dispense separately. If you've got oak bark for someone with gingivitis, for example, and you want to treat them for periodontal disease as well, you'd probably make up a myrrh and golden seal separately from your tannin-containing herbs such as oak bark, and use them separately. High percentage alcoholic extracts such as myrrh, where you're really looking for the resins, they may precipitate with liquids of lower percentage. They need a good shake, or you separate them. Mix herbs according to their ethanolic content, highest first. You'll know that from the side of the bottles of your herbs. You are not expected to remember that. Mucilaginous herbs, when you're looking for the for that beautiful mucilaginous effect. You don't want to dissipate it with high alcohol. So once again, marshmallow, those type of herbs, either given a glycerate or separately. With the resinous herbs, Kerry Bone does recommend that you mix some saponin containing herbs, and that can actually help break up the resin. Low dose herbs, really you're looking at herbs that are either intolerable at higher dosage, such as cayenne pepper, which will obviously be very burny, and other herbs which you don't want to push too hard on, such as poke root, which has a good impact on the lymphatic system but can be toxic in higher dosages. And you can see here you've got 1 in 10 in capsicum, 1 in 5 fada lacca. Jacqueline's nigra is a very interesting one. Black walnut, we use it in constipation and for parasitic infestation. That is in the low dose at a 1 in 2. However, MediHerb, for example, have an extract at 1 in 10, which effectively turns it into a medium dose herb, so that it can be used between 10 and 40. So obviously, once again, confused, I know, but it really comes down to the manufacturers, so don't get too bogged down. Medium dose herb, these are almost all the herbs we have, so they're between 10 and 50 in a 100ml bottle. Generally, I'll put in 25 mils of the medium dose, unless I want a specific effect. For example, from St Mary Thistle, I might put in 50. I might do that as a double whammy, just to get a nicer effect, particularly if I'm dealing with hepatitis A or something like that. Higher dose herbs, they're mainly the demulcent herbs and the alterative and lymphatics. However, something like the curcuma and withania, they've now come down into the medium dose herbs. Certainly with withania is now standardized for its withanolones, Sunday. And that's now a 2-in-1 extract, and the same with tribulus. Glycyrrhiza is an interesting one. You can get various forms of glycyrrhiza, some that have certain extraction process where you don't need to worry about the deglycyrized ones, where you don't have to worry about the caution so much. Frequency, this is just how we pronounce it. SIDs, 1 daily. BID or BD, twice daily, TID. The way you'd always write it for the client is 5 mils, 3 times daily. You wouldn't put TID, they don't understand. Bitters, try and take them 10 to 20 minutes before food because they're going to stimulate the digestion. So how much is in a bottle of herbs? 100 ml normally lasts about 7 days, 200 2 weeks, 500 5 weeks. So work out your 100 ml formula, and then you can actually double the dosages or quadruple, depending on how much you need to give them over a period of time. By doing 100 mils, it also allows you to tweak if you need to. And I always start off with 100 mils just in case the client doesn't like the herbs or can't comply, and really to make sure that they're getting an effect. Considerations: there are no hard and fast rules for dosaging. There are only safe rules. So you must consider the toxicity of the herb. That is what determines the dose. The type of illness, is it chronic or is it acute? If it's chronic, they may well need a much lower dose. If it's acute, such as flus, you're going to go in hard and fast and high, certainly with herbs such as yarrow, elderflower and peppermint. Age and constitution will also dictate the dose and often the selection of the herb. So I hope this has been useful. Please read your books. You need to keep reading. You need to keep asking. I hope that this has clarified a few issues, and we will obviously talk more as time goes on. Thank you very much. If you found this useful, let me know if there's any other information you want. Thank you.